On Tuesday, President Obama signed Patient Protection and Affordable Care Act into law. Before making it official, he listed positive aspects of the reform.
Tens of thousands of uninsured Americans with pre-existing conditions will finally be able to purchase the coverage they need. Insurance companies will no longer be able to drop people's coverage when they get sick. They won't be able to place lifetime limits or restrictive annual limits on the amount of care they can receive. Once this reform is implemented, health insurance exchanges will be created, a competitive marketplace where uninsured people and small businesses will finally be able to purchase affordable quality insurance. They will be able to be part of a big pool and get the same good deal that members of Congress get. That's what's going to happen under this reform.
The bill has been proclaimed historic, and the media, following administration's lead, call the House vote a victory. But supporters of the health reform are divided on the merits of the legislation.
To call this a victory for healthcare as a human right, I think is a mistake. This is not a victory. It is as much a victory for corporate America and for price gouging and for exploitation as it is anything else.
A day before the bill was signed into law, a coalition of over a dozen of healthcare organizations held a press conference on Capitol Hill declaring their support for the reform and urging the Senate to pass the reconciliation bill.
What's the word? Reconciliation. What's the deed?
And we supported the public option to begin. We supported the more robust version of the bill to begin with, but we're absolutely delighted with what has happened so far, and we're proud to stand with our partners.
This is a day to be very proud of America, to be very proud of democracy, and we're finally going to be able to hold our heads up straight. How can we hold our heads up when we see the European countries, all the other countries, having better health care outcomes, everybody covered, and we don't? That's going to change.
The same day, Physicians for National Health Program, a nonprofit organization of 17,000 physicians and health professionals, published their study of the House Health Bill. According to PNHP, about 23 million people will remain uninsured 9 years out.
It's clear to us that this legislation will not significantly increase the number of people that can have coverage, will still result in bankruptcies due to medical debt and foreclosures on homes due to medical debt, will still keep this, the problems that we have in this country. It's not addressing those problems. They're trying to regulate the insurance industry, but that's been tried over and over, and they are too powerful. It doesn't work. They find a way around it.
I know that there are critics out there who said we didn't go far enough, and we did compromise. But that's what we do in a democracy. We compromise, but we keep working. We know that no bill is perfect and no legislation is perfect, and we are not going anywhere because as doctors and nurses, we're going to be the ones that implement this, and we're going to see firsthand the holes that are going to, that might be in this legislation.
There are some things that people could say are positive aspects, but overall it's not a solution. It will do more harm than good. And remember that most of the provisions of the legislation don't even kick in for 4 more years. New legislation forces people to purchase insurance, but no guarantee that it's going to be affordable. Still going to face financial barriers of co-pays and deductibles. You're still going to have uncovered services that you have to pay for out of your own pocket. You still have to go through the restrictions of which doctors you can see and which you can't, which treatment you can get, which can't. It's not changing the fundamental problem that we have in this country.
I think it's a negative to have the combination of huge amounts of dollars from the U.S. Treasury going into a private insurance-based healthcare for-profit system and not giving people an option to use their own money or government money for something that is not for profit when we're talking about a human right, which is healthcare. A lot of the 32 million people we keep hearing about who will be covered by adding them as low-income people to the Medicaid rolls. And so the availability of healthcare providers who will take people covered by Medicaid is an open question.
The Medicaid program is strapped right now, but one important thing that's going to come in reconciliation is actually increased payments for primary care doctors in the Medicaid program.
The reimbursement rates may be shored up for a while, but then over a period of time, those are going to be chipped away at. As a matter of fact, I think that's one of the big dangers, that this is all going to be put in the category of an entitlement. And people here on Capitol Hill love to attack entitlements and cut and reduce and tighten belts. And that's been the experience of many people. For instance, look at the families who suffered so-called welfare reform in the mid-1990s. How can it be an entitlement that the political system can titrate and slice that and dice and reduce over a period of time. If it's a human right, is the law not saying that some human right is more a human right than others? Some people have a full human right, some people have a partial human right, some people are in a full-blown quality health care human right, and some are down there in the basement of human rights that's called Medicaid.
Having backed out of the original promise to oppose the bill unless it contains a robust public option, progressive Democrats have now returned to the discussion of government-funded insurance. Lynn Woolsey, co-chair of Congressional Progressive Caucus, has announced her intention to reintroduce a robust public option.
I will introduce a robust public option on the very day that the president signs the health care reconciliation bill into law.
The Senate is going to try to pass the budget reconciliation bill this week. Under the rules, senators have 20 hours to debate the bill, and amendments would be very limited or none at all.
This effort from some in the House and Senate to say, okay, now that we've passed a new health care bill that is a profound reform, we're told, now we're going to go back and get a public option. It is beyond credulity, I believe, that in 2011, the Congress will pass a public option when the president has refused to fight for it in the past.